Hi there, I'm Dr. Richard Finn from UCLA in Los Angeles, California, here at ESMO 2024 to give a brief recap of some of the larger liver cancer studies presented. Starting in advanced disease, we saw updates from the HIMALAYA and 9DW study. HIMALAYA, looking at durvalumab and tremelimumab in advanced liver cancer, had long-term follow-up data now at 5 years. And though the number of patients at risk at 5 years is relatively small, we saw a nice delta, a number of patients in the realm of 15-20% that are still alive at this time point, and no new toxicity. At the same time, we saw updates from the 9DW study initially presented at ASCO 2024, which was IPP Neo versus lenvatinib or sorafenib. This study did show an improvement in overall survival. Interestingly, the curves for the first year are a little flipped, meaning the control arm is doing better than IPP Neo. We still do not have a good reason for that. But after that point, there is a strong and continued benefit in terms of survival with IPP Neo. The toxicity has not changed with long-term follow-up. This was 3-year follow-up, and we see a number of patients are still alive at this time point, but again, the number at risk decrease over time. Then if we turn our attention to intermediate disease, a very important study, the LEAP-012 study was presented. This was a study in intermediate disease for patients who received chemoembolization or chemoembolization with the combination of lenvatinib and pembrolizumab. This was a positive study. The primary readout was progression-free survival, and the hazard ratio was in the 0.6 range, with a trend towards overall survival, with a hazard ratio of 0.8, but still statistically not significant. No new toxicity signals with len and pembro. And could this regimen get approved? Yes. An improvement in objective response rates as well with the combination in an area of unmet need. And we'll have to wait for some further follow-up and decisions from regulators. Finally, we saw updated results from IMbrave050. This was a study that's been published last year and presented last year, looking at adjuvant atezolizumab and bevacizumab in patients who were resected with curative intent, but at high risk for recurrence. As we all know, the first interim analysis was quite positive, showing that with shorter period of follow-up, there was a significant decrease in the risk of recurrence with atezo-bev. However, now with longer follow-up, this benefit seems to be diminished, and what was a positive study has turned negative. There were no new safety signals, and there probably is still a group of patients that get a benefit. We just don't know who they are. Recurrence-free survival for both arms is quite long, much longer than we expected, which tells us defining this high-risk population liver cancer is still a challenge. At the end of the day, frontline atezo-bev is a very active regimen. Both HIMALAYA and 9DW also are active regimens. Some nuance in choosing a regimen, and then in intermediate and early disease, we're still waiting for approvals. Thank you very much.